class is on spotters, nutrition spotters. These are already discussed in your small group discussion classes. Today I will give just a rapid revision. Okay, not all types of questions will be asked, but I will try to point out important parts that might be asked in your exam. And after your pre-prof, if any of you have some confusions or you want to see the specimens in person, just come to the department. All those are kept in the museum. So come in small groups, okay, not a large group and not alone. Preferably 20 to 25 or 30. Come in small group, that much groups, and we will show it to you. Okay, if you need it. I don't think that is needed, but still, if you have any confusion, any questions, any problems, you can come. Okay. So, nutrition spotters. First of all, what will be given? That one item will be placed in front of you. Okay, and you have to answer some questions. First is obviously important, that is identification. If you identify it wrong, then the next all answers will be wrong. Even if you write correctly, if you identify it wrong, the entire marks will be deducted. Okay. So identification, although it has some very less number, sometimes half, sometimes 1. Okay, but still you have to write it correctly. So nutritive spotters, what are the things that might be given? First is wheat, then polished rice or parboiled rice, maize, bajra, ragi, rajma, red gram, green gram whole, sometimes even egg, Bengal gram. Flax or linseed is not available now, okay, with us. You can omit that. And obviously milk, okay. So you have to remember at least 12 to 13, and obviously groundnut. So you have to remember all this, how it is looks. I think all of you know how it looks, okay. That is not the problematic part for nutrition spotters, okay. Usually nutritive value we ask for rice, wheat, maize, those things, okay. Try to remember the protein content. If you can remember the protein content of rice, always double it, okay. You do not have to write the exact 6.8, you can write it 7, okay. But we expect 6.8 from you, whatever, you can write 7, but remember you can write it to double for wheat and maize, but if you write too much high or too much low, it will be obvious, okay. And obviously what are the main nutritives present in difference? That rice have very low part of B1, but in wheat and maize, the content of B1 is much more higher, and there lies the importance of parboiling, correct? Why? Then those who are only consumed rice or cannot eat wheat and maize, probably has some IBS or something. How they will get B1? We have to contain the B1 of the rice. So that is why we do parboiling. So these are wheats. You all know how it looks. Okay. Usually what we ask, mention which food group. You all know it comes to the cereal. Give the energy content of 100 gram of this item, 340 to 350. Usually 340, and it is same for also rice. 100 gram rice also contain the same amount of energy. Okay. And what are the name of the limiting amino acids? That is lysine and threonine. What is the meaning of limiting amino acids? Deficient. These amino acids are deficient in this food item. Also, as we are discussing about wheat, we also have discuss with its protein content. Okay, so in protein content, what you have to read, that is NPU, net protein utilization. Okay, what is the definition? It might be asked in your spotter, or it's also a very important Viva question for examiners from nutrition part. Okay, and NPU is for wheat is 51%. It is easier to remember, almost half. Okay. In protein, what are the important amino acids? You have to remember if we are talking about amino acids. What are the essential amino acids? How in number? How many in number? Essential amino acids. What are the newest amino essential, semi-essential amino acids? Hmm? What are the essential fatty acids? What are the name? That are amino acid. I am now asking about fatty acid. What are the essential fatty acids? Linoleic, linoleic and arachidonic. Correct. Why essential? Because we cannot produce in our body these amino acids or fatty acids. Okay. We have to take it from the outside source. And the protein content in the wheat, what we call is gluten. Okay. This question, it might come, is it superior to rice? If so, in what way? Again, the protein content. Here I did not write the amount, but we will expect from that previous table that you write the amount also. Okay. It will carry higher marks. Hence, it is superior in quantity and also quality wise, but quality wise rice is better because it is rich in vitamin B1. That was 0.6 and that was 0.4. Na? So, it is somewhat, but we lost it to polished rice. And also, if we usually eat less amount of rice, higher amounts of rotis. That's it. That's where it makes the difference. That is why we have to store the vitamin B1. And what is for wheat? What is the preferred way of consuming? Whole wheat flour. Okay, not flour, it will be flour and not the processed and refined white flour, which is what we call as maida. Okay, it is better to consume in as atta. Chakki press bolte tha na, same. Now coming to the next item, polished rice. Previously, I showed you in previous classes, I showed you how to differentiate between milled and not milled rice. Polished or milled rice is same. Okay. In mill, it goes for only polishing. What is the difference? It looks much brighter and whitish. Usually, parboiled and not milled rice are looking somewhat brownish. You can check the previous PPT. I have given the picture. Okay. Side by side. In your spotter, you have to mention whether it is polished rice or not. Okay. Here, what process can say parboiling that we discussed, and what happens here from outer husk, the vitamin B1 usually stored in the outer husk, but if we do by parboiling, it goes into inner endosperm. And here also one thing we can ask about the process of parboiling. So remember that. Okay. Rice eaters are prone to develop which vitamin deficiency disorder? Okay. If we are now talking about rice eater, this rice is always you have to assume that It is, we are talking about polished rice, okay. And vitamin B1 causes very two types, wet and dry. Important nutrients. Now coming to this is a picture of parboiled rice. Notice that it is somewhat brownish in color and it looks not so bright. Okay. Here it is sometime asked the technique recommended by the Central Food Technological Research Institute for parboiling. That is, we usually in park also the name is given, that was hot soaking process. Okay, this is the name. It's not a good name, but this is the term they use. It might be asked. Okay, this is the question. It is favorite for examiners. We all know about the advantage of the parboiling. What is the disadvantage? If parboiling is that much good, why still we are preferring polished rice? That is the answer. After parboiling, the rice usually gives a peculiar, very peculiar smell. It cannot be compared with other things. Okay. The smell is the reason why people are avoiding parboiled rice. Okay. And which vitamins are deficient in it? For parboiled rice, it is rich in vitamin B. But what is lost? A, D and C. Why it is lost? A and D, those are fat soluble vitamins. Correct. It lost in the heat. And vitamin C is water soluble. So, when you are soaking it, it got lost in the water. Now coming to the next item, that is maize or corn. Okay. This thing will not be given obviously. This will be given. Okay. Again, what is the group? Cereal. Protein and energy content, that is 11 gram% and 342. So, it is same again for rice, wheat and corn. The energy amount it given per 100 gram is always the same. Now, what are the limiting amino acid? Here the options changes. Here, what are the limiting? Tryptophan and lysine. What is the disease? Due to excess consumption for long term. Pellagra. So, what vitamin deficiency? Pellagra? Niacin. Vitamin B? B3. And what are this? Again the same questions. What is the cheap protein here? Here the answer is gluteline, not gluten. Okay. It might be asked, okay, how the quality can be improved. That is the incorporation of OPEC2 gene. This is some higher question. Examiner might ask you, okay. It will not be a typical spotter question. Now for the millets nutritive value, again Ragi 7.3, Jowar 10.4, Bajra 11.6, and obviously you will remember the deficient amino acid lysine, lysine and threonine for Jowar and Bajra. Okay, millets it might come. Okay, Bajra, pearl millet. Okay, usually it will be given as a whole, otherwise you cannot identify. This we have collected and it might come in your exam. Okay, Bajra. Usually what we call it as pearl millet. Why? Because it looks like pearl. The white is hue. Again, almost circular in to see. Here the what is the two mineral abundant in it? Calcium and iron. Remember, this is specifically remember for Bajra. Okay. Nutritive value is not important for you. It will not be given. But here this term staple diet and where it is mostly common. It is usually we all know from our secondary times that millets are usually people eat it in those who are living in Rajasthan or Gujarat and Maharashtra, usually western part of our country. But what this term staple diet, what is it? What is the here always try to remember the definition of diets, that what is dash diet, what is the ideal diet and what is staple diet. Okay, what is staple diet? Anybody? Any idea at least for that region? And it has to be, if we are talking the word is diet, it has to be contain all the necessary nutrients, whether it is macro or micro. Ragi, this is not important. Okay, Rajma, this is important. How to identify? Obviously, you know it is bigger in size and almost bean shaped. What are the food groups? That is pulses. Protein content 22.3 gram. But energy again same 346. Always remember the word 340. Okay, 342 or 346 doesn't matter. But it should not be 1340 or 430. It has to be 3, 4 and 0. Okay, remember this. Red gram, we all know it. What is the name in Bengali? Musurid dal. What is the limiting amino acid? Methionine and cysteine. And that is why, what is the khichdi known as? What is the complement? You have to mention the complementary actions of amino acids. Rice is deficient in this. Red gram is deficient in this, and what is deficient? That is much more in amount in the other one. That is the complementary action, na? That is why khichdi or hodgepodge, that what we know, it is known as complementary actions. But what is diet is known? What is known as? Huh? Read. Green gram. What we known as this as? Green gram, it might be given as split or sometimes as whole also. Okay, what do we know this as? What do we know this as in Bengali? Huh? Chola dal. Simple. Now here, this value is different from 340, 360 kilocalorie per 100 gram. Okay. This gota moong or green gram. Green gram, this is the sprouting. What is the sprouting? Why sprouting is important? For green gram only. Usually we consume it like that. Na? Sometimes we soak it in the water for overnight and usually the sprouts came and then we consume it. Why? Because if we soak it, then the nutrients come to the in the middle. That means usually from the outer part to the middle part, and it became much more easy to digest. That is why it is advised to consume it after sprouting. Okay. What is the nutrient? The above process enrich vitamin B complex and vitamin C. What is this? Bengal gram? Limiting amino acid, all you know this. Okay, if we go give this as whole, again the answer will be same. Black gram, it will not be given, but from this picture also try to remember the khesari. Okay, it might be given in your exam. And in the khesari, what is the toxic principle? OA. Huh? BOA. And what are the stages of this disease? Lathyrism? Crawling stage. Very good. And where it is prominent? Where prominent means in which part of the country we seen this? Western part. Correct. Again, how we destroy the BOA? What is the way? Parboiling again. Wait. Linseed is not important. Nut, groundnut, cashew or almond is too much high price. Okay, we cannot keep it in a jar. It is not easy to buy. So, but groundnut, it might be, it will be given as a spotter. Okay. Again, what is the in general any type of nuts? What is the highest content? That is protein. And what are the deficient amino acid? Again, lysine and methionine. Okay, this is what we call as groundnut. And what is name of the toxin which is produced due to its improper storage? That is aflatoxin. What aflatoxin causes? Good. This you all know. Okay. Don't try to break it in the exam. নষ্ট করে দিলাম তাহলে পাল্টাতে বাধ্য হবে NPU if it is 50 for 50 কার জন্য ছিল wheat for egg it is 100%. Okay, and what are the nutrients deficient? Carbohydrate and vitamin C. What is the disadvantage? A substance called avidin. And how to counter it? Can anyone answer? Boil করতে হবে আর কিন্তু র ডিম তো অনেকেই খায় খায় না জিম যারা করে তাদের এখানে অনেকেই জিমে যায় হয় না র এগস দুটো খেয়ে একদম হ্যাঁ বলেছে তো হাউ টু কাউন্টার ইট nutritive value it might be asked what is the usual from family. You all know that if we are talking about an egg, you have to take 60 gram as the weight for one egg. Okay, and it contains protein in 6, fat also 6, and calorie usually we write it as 60, but now it is 70 or something. It is written. It also differs from egg source to another source. If it is from same birds, it is usually what we eat. It is content usually 65 to 60 to 65. Okay. What are the rich source of vitamin A and D? And the white part is pure albumin. What disease can it cause? Salmonellosis. What is the importance in lab setting? You all know that chick embryo is used for chick. This is tissue culture different, and chick embryo is used for test of rabies vaccine to either human or equine. Anything else? Chick embryo আমরা test করি for some virus and some bacteria also, na? Chick embryo, remember? What is the test for freshness of egg? Floating, okay. Candling is not possible, but how do we differentiate from a good one and bad? A good egg always floats in the, floats or sinks? Sinks. And if it is rotten, and it will produce gas, and that's why it will floats, okay. Now coming to the milk, picture is not needed, I hope. And milk, if we are talking, if we are always talking about cow's milk, okay. Three methods of pasteurization of milk. Try to remember the process also, at least for this holder method, okay. HTST or UHT, these are small methods. UHT very high heat for a small time. HTST also try to remember the temperature and the duration and the cooling period. And holder, all you know, that is the classical method, and it is useful for home settings also. What are the two diseases? It can be transmitted through infected or contaminated milk, bovine TB and brucellosis, okay. Bovine TB is not that much of importance, but brucellosis is, it might be a fatal disease also, okay. And as per nutrient constitute, nutritive value and nutrient constituents, it is given in your book, okay. What is milk also deficient in? কি থাকে না, ইউজুয়ালি আইডিয়াল বলা হয় না মিল্ককে, সুষম খাদ্য বেঙ্গলি, বাট কি থাকে না? Vitamin C. Proteins, casein for cow milk, okay. And obviously what is the mineral deficient? That is iron. Nutritive value is given. What are the difference between human and buffalo and cow, okay. You do not have to remember this, but just remember what is higher in number in human milks, okay. Just this thing. So these are the nutrition spotters that will be given, okay. We will not give any other thing such as Maggi একটা প্যাকেট রেখে কোশ্চেন আমরা করব না, ঠিক আছে। এর মধ্যেই যা থাকার থাকবে। আর তোমাদের আর একটা এসেছিল, রিকোয়েস্ট ছিল ভ্যাকসিন স্পটার্স, কারেক্ট। ভ্যাকসিন তো অলরেডি সিনহা স্যার পড়াচ্ছেন, তারপরেও যদি তোমাদের ভ্যাকসিন চোখের সামনে দেখার থাকে, এগেন যেটা বললাম, স্মল গ্রুপ করে আসবে, ভ্যাকসিনগুলো শো করা হবে, ঠিক আছে। ইউজুয়ালি প্রিভিয়াস আগে যখন ক্লাস নেওয়া হয়েছিল প্রত্যেকটা ভ্যাকসিন দেখানো হয়েছে তখন। ট্রাই টু সার্চ ফর দ্য ভিডিও অলসো, ওকে। And for vaccines you have to always remember the as per NIS schedule when it is given, okay. And what are the possible AEFI for that vaccine? The list is given in the park, and obviously dose and site, dose, site and as time, you have to remember that, and obviously the possible AEFI. And what will be the cases of misdose? That will be your problem cards. Vaccine is very much important. And obviously always remember what are the heat sensitive, cold sensitive vaccines. I have given the pneumonics also. At least এটা পিপিটিটা খুঁজে বার করে পড়বে, তো সবই বলেছিলাম। And if asked, if you can answer all this, it might be asked where it is stored, in the lower cell or the lower racks or the upper racks. It depends on whether the vaccine is heat sensitive or cold sensitive, okay. And what are the light sensitive vaccines? BCG আর vitamin A আর কিছু আছে? Probably না। So always remember the light sensitive vaccine, name of the light sensitive vaccines also, okay. It might be asked in your spotters. If not spotters, it will be asked in your Viva question.